Shortness of breath, also known as dyspnea, is a common symptom that can be caused by various underlying conditions. It refers to the sensation of not being able to breathe well or feeling an increased effort to breathe. This can range from mild to severe and may be acute sudden onset or chronic long-lasting. Overview definition: a subjective feeling of difficulty in breathing or a sensation of breathlessness. Common descriptions: patients may describe it as their hunger, tightness in the chest, or feeling like they can't catch their breath. Causes: shortness of breath can result from a variety of conditions, including respiratory disorders, asthma, a chronic condition causing airway inflammation and narrowing, chronic obstructive pulmonary disease (COPD), a group of lung diseases like emphysema and chronic bronchitis that obstruct airflow, pneumonia, lung infection that causes inflammation and fluid accumulation, pulmonary embolism, a blockage in the pulmonary artery, usually from a blood clot, interstitial lung disease, scarring of lung tissue leading to difficulty breathing, cardiovascular conditions, heart failure, the heart's inability to pump blood effectively, leading to fluid buildup in the lungs, coronary artery disease, reduced blood flow to the heart muscle can lead to shortness of breath, especially during exertion. Arrhythmias, irregular heartbeats can disrupt blood flow and lead to breathlessness. Other causes: anxiety disorders, panic attacks and anxiety can manifest as shortness of breath. Obesity, excess weight can place additional strain on the lungs and heart. Anemia, low red blood cell count can lead to insufficient oxygen delivery to the body. Infections, viral or bacterial infections affecting the chest can lead to breathing difficulties. Symptoms: shortness of breath can be accompanied by other symptoms, depending on the underlying cause, such as coughing with or without sputum, wheezing or noisy breathing, chest pain or tightness, rapid or shallow breathing, fatigue or weakness, cyanosis, bluish color of lips or fingertips. Diagnosis: diagnosing the cause of shortness of breath typically involves a thorough medical history and physical examination, along with various tests, including medical history, discussion of symptoms, duration, and any associated factors e.g. exertion, position. Physical examination, assessment of respiratory rate, heart rate, oxygen saturation, and lung sounds. Imaging studies, chest X-ray, to check for lung or heart issues. CT scan, more detailed imaging for conditions like pulmonary embolism or interstitial lung disease. Pulmonary function tests, assess lung capacity and function. Blood tests, to check for anemia, infection, or other metabolic issues. Electrocardiogram ECG to evaluate heart function and rhythm. Treatment for shortness of breath focuses on addressing the underlying cause. Options may include medications, bronchodilators, for asthma and COPD to open airways, steroids, to reduce inflammation and respiratory conditions, diuretics, for heart failure to reduce fluid overload, antibiotics, for bacterial infections like pneumonia. Oxygen therapy, supplemental oxygen may be necessary for patients with low oxygen saturation levels. Lifestyle modifications. Weight management, losing weight can reduce strain on the heart and lungs. Smoking cessation, quitting smoking is crucial for lung health. Exercise. Pulmonary rehabilitation programs can help improve lung capacity and endurance. Emergency care. In cases of severe shortness of breath, immediate medical attention may be necessary, especially if it is associated with chest pain, confusion, or a sudden onset of symptoms. Prognosis. The prognosis for shortness of breath depends on the underlying cause. Some conditions, like asthma or anxiety, can be well managed with treatment. Others, like chronic heart or lung diseases, may require ongoing management to control symptoms and maintain quality of life. Conclusion: shortness of breath is a significant symptom that can indicate various health issues, ranging from mild to severe. Prompt medical evaluation is essential to identify the cause and initiate appropriate treatment. If you or someone else experiences unexplained or worsening shortness of breath, especially if accompanied by other concerning symptoms, it is crucial to seek medical attention promptly.